My name is Dean Maines. I lead an organization known as the Veritas Institute. I'll say a little bit more about the organization here in a few minutes. And as Joan alluded to, the Veritas Institute has been working with Trinity Health since 2011 to apply an assessment process known as the Catholic Identity Matrix within Trinity Health's ministry organizations. And currently, looking out into the future, this is a tool that we're looking at applying here within the Mount Carmel system. So what I want to do over the next hour is just introduce you to the Catholic Identity Matrix, help you understand what it is and how it works. Now, in terms of specific goals for the next hour, I have three of them. And my first and my primary goal is to familiarize you with this assessment tool known as the Catholic Identity Matrix, or the SIM, as we've nicknamed it. And as its name suggests, the SIM is intended to help leaders in Catholic healthcare, such as yourselves, address the challenge of strengthening and renewing the Catholic identity of their organization. Now, the SIM is not an external audit. It's not a JCO kind of event. Rather, it's an externally facilitated self-assessment that enables a Catholic hospital to appraise and then improve the extent to which 6 principles for Catholic healthcare have been integrated within the organization's management system. So what we're going to do today is I'm going to give you an overview of the SIM. We're going to look at the history and the background of the process. I'm going to present the assessment framework that's used within the SIM. We'll look at a couple of example assessment questions taken from that framework. And then we'll talk about how the SIM works, how it's actually implemented within an organization. Second, I'm going to very briefly touch upon the application of the SIM here within the hospitals of the Mount Carmel system. And discussions around those implementations are just now beginning. They'll be continuing in the upcoming months. What I'm going to simply lay out for you this morning is an example implementation calendar. And that calendar will identify some of the major milestones within a SIM implementation, and it will help you to get a sense for the relative timing of those events. And so it'll make the implementation process hopefully a little more concrete for you. And then finally, I'll be happy to address any questions that you have about the SIM. Now, there's about 50 minutes of content in this presentation, and I think we've scheduled 2 hours, so we should have plenty of time for questions and for discussions. By the way, can you hear me okay? All right. Let me say just a few words about the Veritas Institute by way of introduction, just to help you understand who we are and what we do. The Veritas Institute was founded in the year 2007. We are a university-based center. We're a part of the Opus College of Business at the University of St. Thomas, which is located in the Twin Cities of Minneapolis and St. Paul. Now, I know Bishop Campbell knows St. Thomas because he was the rector of the seminary there for many years, but we're not exactly a household name. So I don't imagine that the rest of you have any familiarity with the university. We are the largest archdiocesan university in the United States. We have roughly 11,000 students. We also have a campus in Rome. And St. Thomas, if you go out and you talk among educators, what it's best known for is the field of business ethics, the discipline of business ethics. We have the largest business ethics faculty anywhere in the United States and arguably anywhere in the world. And a lot of the research that is done within St. Thomas has to do with the connection between ethics and management practice, and specifically between Catholic social teaching and management practice. And several of my colleagues at the university contributed to that document that you see in front of you, which was issued by the Pontifical Council for Justice and Peace. It's a reflection upon the vocation of the business leader. And what it does is it attempts to take Catholic social teaching down from the 30,000-foot level and to make it real, to help people understand what its implications are for how businesses are managed, how businesses are led. And it's a document that has had incredible success in the last year. It's now been translated into 11 different languages and has received very positive press, both from journals that tend to lean towards the left and journals that tend to lean towards the right. So that says that there's probably some great substance in there as well. Coming back to the Veritas Institute, the fundamental purpose of the Veritas Institute is to foster ethically responsible organizational conduct. And we do that by promoting the use of an assessment method known as the Self-Assessment and Improvement Process, or SAIP. And the SAIP is simply an assessment method that helps both for-profit and not-for-profit organizations appraise and then enhance their performance on questions of organizational ethics, on questions of corporate ethics. If you look at the Veritas Institute's work, it really falls into three general categories. First of all, we work directly with organizations to help them implement assessment tools that are based on the SAIP method, and the Catholic Identity Matrix is one of those tools. Secondly, we extend the SAIP method to new applications by developing new assessment tools. And then finally, being a university-based center, we're involved in teaching. We develop case studies that are used within St. Thomas's MBA program, as well as the MBA programs of other universities. And we also perform research, specifically around the institutionalization of ethics within organizations. That is, how both for-profit and not-for-profit organizations make ethical conduct part and parcel of the way in which they do their work. Now, I want to say just a few words about the SAIP method itself, just to give you a sense for how we approach this general task of organizational assessment. The SAIP method is modeled after the organizational assessment process that was pioneered within the Malcolm Baldrige National Quality Program, or as it's known today, the Baldrige Performance Excellence Program. And what the SAIP does is it uses the Baldrige approach to translate a set of ethical principles into a systematic inventory of questions concerning an organization's management system. That is, those operating policies, processes, and practices that shape how the organization does its work. So by answering those questions on the basis of data, on the basis of evidence, and then scoring those responses using a scoring system, the SAIP method enables an organization to identify areas where its stated moral values have been integrated within its management system, as well as areas where that integration may be more tenuous or incomplete or totally lacking. And then the information that's generated through the assessment process assists with the formulation of initiatives that address performance needs or address improvement needs. That is, that address those parts of the organization's management system where those values perhaps are not as well embedded as they should be. So in this way, the SAIP method helps the organization develop a stronger tie, a link between its management system, its operations, and those moral values and moral principles that it aspires to follow. And so in that way, it helps the organization do a better job of walking its moral talk, of acting with moral integrity. So that's just a little bit about the SAIP method, which again, it underlies the Catholic Identity Matrix. So let's begin to look specifically at the Catholic Identity Matrix. And I want to start by just sharing a little bit of background about the process. I have to correct Sister Barbara. She gave me credit for creating this. There were lots of hands on the tiller in terms of putting the Catholic identity matrix together. The prototype of what eventually became known as the Catholic Identity Matrix was actually developed in 2006 within Ascension Health. And it was developed in direct response to a request from the sponsoring congregations of Ascension Health. Now, in 2006, that prototype was used to perform a kind of corporate level assessment within Ascension Health. And the results of that assessment suggested that the prototype was promising, it was a good first step, but it also needed to be made more rigorous and more evidence-based. Now, the Veritas Institute became involved with the SIM's development in the year 2007, and essentially we worked with our colleagues at Ascension Health to improve their prototype by integrating within it that general SAIP method. And it's really the combination of Ascension Health's prototype and the SAIP method that resulted in the Catholic Identity Matrix as we know it today. Also in 2007, Ascension Health performed a second corporate level assessment, this time using the improved version of the tool, and the Veritas Institute facilitated that implementation. Now, that 2007 assessment suggested that the SIM could be helpful to both leaders and managers inside Catholic healthcare. So the focus was then placed on adapting the process for use within ministry organizations, and specifically within acute care hospitals. I think that move was really driven by the belief that when it comes to questions of mission integration or questions of Catholic identity, the rubber really hits the road within that acute care setting. And so we wanted to make sure that the tool would be useful at that particular organizational level. So during 2008 and 2009, the SIM was piloted in 9 different hospitals in 5 different geographic locations. Those hospitals ranged in size from about 500 beds all the way down to 20 beds. All of those hospitals happened to be within the Ascension Health system, and the Veritas Institute facilitated those implementations. Now, looking back into 2010, 2011, and 2012, and then looking out into the future, what we're seeing right now is rapidly expanding use of the Catholic Identity Matrix within Catholic healthcare generally, not simply within Ascension Health. And that's true both nationally and internationally. Currently, the Veritas Institute is working with 8 different health systems to facilitate the implementation of the SIM, including Trinity Health and Catholic Health East. We've started a relationship with Catholic Health East last year. Right now, we're on track to complete our 36th implementation of the tool in July of 2013. Internationally, we're collaborating with diocesan representatives in Germany to adapt the SIM for use within Catholic hospitals in that country. And during 2013, 3 pilots of the SIM in Germany will be taking place. Another development here is that efforts are underway to extend the SIM across the continuum of care. We've done a lot of work in acute care hospitals. Last year, we had a chance to pilot the process within a network of outpatient clinics. We're also beginning to look at adapting the tool for use within long-term care facilities. So that's a little bit about the origins of the process, where it's been in the past, where it is currently, and where we see the SIM going in the future. Okay, let's begin to take a look at the structure of the SIM, and then we're going to talk about how it's actually applied within a hospital. Now, the SIM uses the general SAIP method in conjunction with 6 principles for Catholic healthcare. 6 principles that arguably are applicable to any Catholic healthcare organization. And those principles are listed on this particular slide. Now, these principles are drawn from a variety of sources, including the ethical and religious directives, also the experience of Catholic healthcare leaders based on some research that was done by the Catholic Health Association roughly 10 years ago. Also, CHA's shared statement of identity for the Catholic health ministry. And then the principles also draw upon the Catholic social tradition, Catholic social teaching, Catholic social thought, Catholic social practice. Now, these 6 principles are founded upon the 2 core convictions which broadly inform the Catholic moral tradition, namely the dignity of the human person and the common good. And what they help leaders in Catholic healthcare do is understand a bit more specifically what they need to do inside their organizations to ensure that human dignity is respected and the common good is advanced. Now, if you've spent any time in Catholic healthcare, you've probably encountered these principles under some guise, in some way, shape, or form. They may have had a slightly different name. They may have had a slightly different label. But the 6 principles include, first of all, solidarity with the poor, solidarity with those who live in poverty, giving priority to the healthcare needs of the poor and the marginalized who live within the community that the hospital serves, but also advocating on behalf of those groups within the broader community and within the broader society. Second, holistic care, providing care in an integrated manner that attends to all the dimensions of the human person. The physical dimension, certainly, but also the social, the psychological, and the spiritual dimension. Respect for human life, demonstrating a profound respect for human life in both the services that are provided by the hospital and in how those services are provided, how they're delivered. And doing this with an eye towards the full cycle of human existence. So from conception to birth, through childhood, adolescence, and maturity, all the way to natural death. Participatory community of work, forming an environment, forming a climate inside the organization that encourages participation on the part of all associates, that also places decisions at the most appropriate organizational level, so that decisions that affect the organization as a whole would typically be made by those individuals who have responsibility for the organization as a whole. For example, the folks that would sit in the C-suite of a hospital, while decisions whose impact is primarily local would be made locally, say at the unit level or the department level or at the patient's bedside. And then also fostering respectful interactions between associates, regardless of the role or the position that they hold inside the organization. Stewardship, acting as a good steward of all the resources that have been entrusted to the hospital, the skills, the knowledge, the abilities of its associates or employees, financial assets, plant property and equipment, but also acting as a good steward of the natural environment of God's creation. And then finally, acting in communion with the church, acting as a ministry of the church, operating in alignment with its moral teachings, but also helping the broader church to reflect upon the moral implications of new developments in medical science and new developments in clinical practice. Also, cultivating relationships with critical groups and individuals inside the church through whom the healing ministry of Jesus is shared. For example, founding congregations or sponsoring congregations, local bishops, and then also collaborating with local church agencies and organizations to promote health and well-being within the community that the hospital serves. So those are the 6 principles for Catholic healthcare that are used within the SIM. These are the 6 principles that form kind of the normative basis for the SIM assessment. Now, in addition to those 6 principles, the SIM also identifies 6 tasks which an organization needs to address to implement a principle within its management system, within its operations. And taken together, these 6 tasks comprise what's known as a maturity framework. It's simply a framework that helps the organization ascertain or determine how deeply a principle has been woven within its systems, within its operations. And the 6 tasks or the 6 stages within this framework include, first of all, planning effectively. to implement a principle, ensuring that the principle is reflected within certain statements that broadly orient the organization's work. Mission, vision, and value statements, surely, but also statements of strategic direction, operating strategies. Also annual operating plans that support those strategies, as well as certain overarching policies that govern the hospital's operations. Secondly, developing alignment around a principle, ensuring that leaders and other key personnel are held responsible around a principle's implementation. For example, by reflecting that principle within reporting metrics, within the organization's performance management system, within recognition and compensation structures, as well as within the selection process for key leadership roles. Process embedding the principles within those documented procedures that more specifically guide how the organization does its work, how it goes about producing and then delivering its distinctive suite of services, whether you're talking about the clinical side of the organization or the administrative side. And training, ensuring in a general way that employees, that associates understand a principle and its implications for their work on a general basis, but more specifically ensuring that associates receive the training that they need to implement those documented processes effectively. And then finally, looking at outputs and outcomes. Measurement, having a set of internal measures in place to monitor processes to ensure that they're operating correctly. And then impact, having a set of external measures in place to help the hospital gauge whether all of this activity, all of this effort is having its desired or intended effect upon the community that the hospital serves. Okay, so that's the maturity framework that's used within the SIM. Now, the heart of the SIM is a 6x6 assessment matrix that's formed by juxtaposing those 6 principles for Catholic health care with the 6 stages in the maturity framework. And this is just a schematic representation of that particular matrix. You can see the principles along the left-hand side there, the 6 stages in the maturity framework across the top of the matrix, and those numbers in each one of the cells are simply a labeling convention. Now, there's a grand total of 48 questions that have been distributed across these 36 cells. So on average, each cell within the matrix contains 1 to 2 assessment questions. Answering the questions in a given cell helps the organization determine how effectively it is addressing one of those implementation tasks for a particular principle, for a given principle. So, for example, answering the questions within cell 2.5 enables the organization to determine how effectively it's taking on that measurement task for the principle of holistic care. Now, what I want to do with you at this stage is just share with you a couple of example questions from the matrix, just to give you a more concrete sense for the kinds of questions, the kinds of queries that you find within the assessment. And the first question that we're going to look at is actually taken from cell 2.5. This is the intersection of the principle of holistic care with that stage in the maturity framework. And this particular question asks the organization to identify the measures that it uses to ascertain how satisfied its patients are with the emotional and spiritual care that they receive. So in other words, what are the metrics that the hospital is looking at to determine how effectively it's operationalizing that principle of holistic care from the perspective of its patients, or at least the emotional and spiritual dimension of holistic care. Now, once those metrics have been identified, the organization needs to state where they are today, where they stand currently. Also, the question asks the hospital to identify how those metrics are trending, how they're varying over time. So are they improving over time? Are they deteriorating over time? Or are they holding roughly steady? So that's an example of one type of assessment question you find within the SIM. And this is a question that looks at outputs or outcomes. Okay, this second example question comes from the process cell for the principle of solidarity with the poor. And it asks the organization to identify the process that it follows to create programs that are focused upon the most pressing, the most urgent healthcare needs of the poor and marginalized who live within the local community. So this requires the organization to do several things. First of all, it requires the organization to articulate how it goes about determining who the poor, who the marginalized are within the local community. Because as you know, as you move from location to location, from locale to locale, the composition of that group can change, it can shift. Secondly, the question requires the organization to articulate how it goes about determining what the healthcare needs of that population may be, and how it goes about prioritizing those needs. And then finally, it requires the hospital to articulate how it moves from need identification to the formulation and implementation of programs designed to address those needs. So in this way, the question prompts the organization to examine how it's concretely bringing this principle to life inside its operations, specifically whether it has systematic processes, systematic approaches in place that enable the hospital to operationalize the principle day in and day out. So again, a couple of examples of the assessment questions that you find within the process. Now, I think the assessment framework and the questions give you some insight into how the SIM is structured. I now want to talk about how the SIM is actually applied within an organization. And the application of a SIM takes place roughly in 3 stages. First of all, a preparation to use the process. Secondly, the actual assessment itself. And then last, using the SIM's results to drive improvements. And so what I want to do is just take a few minutes and give you an overview of some of the principal activities that are involved in each one of these stages. Now, preparation simply involves activities that are designed to ensure that the organization is prepared to perform a SIM assessment. And there are 3 primary activities in this stage. And these tasks are undertaken under the leadership of the hospital's mission leader, who serves as kind of the internal process owner for the SIM implementation. They're not done exclusively by that leader, but again, they're the process owner. So the first task is forming assessment teams. When a hospital wants to implement the SIM, they need to form 6 assessment teams, 1 for each of the 6 principles for Catholic healthcare. And depending on the size of the organization in questions, those teams typically contain somewhere between 5 to 8 individuals. Each one of the teams needs to be populated by folks who are familiar with organizational activities that are relevant or cogent to their assigned principle. So think of the principle of holistic care. You certainly would want to include on the assessment team of holistic care individuals who are familiar with the hospital's clinical activities. So you'd expect to find perhaps a nurse or a nurse manager and a physician on that team. But you would also need to include on that team individuals who are familiar with the organization's pastoral care processes, those processes that are in place to help the organization minister to its patients' spiritual needs. So you might typically find someone drawn from the chaplaincy function or from the mission office as well upon this kind of team. Also, the teams need to include a certain diversity of perspective. Specifically, you want to include on each team individuals who are drawn from different organizational levels. And that's really rooted in the fact or in research that shows that where one sits within the organization influences how well one believes that the organization is living out its stated mission or its stated values. Folks who are closer to the top of the organization tend to view that performance more positively. Folks who are closer to the grassroots tend to be a little bit more skeptical about that performance. So you want to have folks drawn from different levels of the organization to ensure that there's a balanced perspective on the organization's performance. So that's the first part of the preparation process, forming assessment teams. The second step, once those teams have been formed, they need to be trained. They need to understand what the sim is, how it works. They also need to be prepared to undertake their part of the sim implementation. And the training typically takes place within the context of a single 3-hour meeting that's conducted by the Veritas Institute. And we try to do 3 things in that process. First of all, we introduce all the members of all the assessment teams to the sim by providing them with an overview of the process that's very similar to what we're going through today, although it's much shorter. Secondly, we go into greater detail about each one of the 6 principles for Catholic health care to help the members of those assessment teams understand more deeply what those principles call a Catholic hospital to do and to become. And then finally, and perhaps most importantly, we give the teams a chance to actually practice performing a sim assessment using a case study that's based on data that has come from a hospital that's used the sim in the past. So it gives them some experience with the assessment process before they attempt to apply it to their own organization. Now the third preparatory task is data collection. The organization must collect and compile information that will help each one of the assessment teams answer the questions in the matrix for their assigned principal. And documentation here includes policies, process maps, procedures that capture how the organization does its work today, as well as data that indicates the outcomes that the organization has achieved to date. For example, results of patient satisfaction surveys, results from associate engagement surveys, performance on vital clinical, financial, quality, and human resource metrics. Now, data collection is by far the most labor-intensive part of a sim implementation, but it's also vitally important because it helps to ensure that the outcomes of the assessment are evidence-based, that they're rooted in the reality of where the organization is today. Okay, so team formation, team training, data collection. That's how an organization prepares to perform a sim assessment. Now, the actual assessment itself takes place within a context of a 4-hour meeting for each one of the 6 assessment teams. And the meeting process is actually quite simple. Each one of the assessment teams is assigned a facilitator from the Veritas Institute. And the facilitator works with the assessment team to use the collected evidence as well as the insight of the team members to answer all the questions for their assigned principal. The team then steps back, they review those responses, and they identify preliminary strengths and opportunities for improvement. And then finally, each team scores their responses using a set of scorecards. Now, typically we receive a lot of questions in these events about how scoring actually works within the sim. So I want to take just a few minutes to give you a sense for the sim's scoring approach. And I want to start with this slide. How many folks here have training in the physical sciences, engineering, physics, that sort of thing? Okay, all right. Now I'm an engineer by training. So when I start thinking about scoring, I start thinking about assessing, I start thinking about measuring, the image that comes to mind is using very elaborate instrumentation to develop highly refined quantitative indicators around some observable phenomenon. And that image feels a little incongruous here because we're talking about assessing mission or assessing ethics, phenomenon that we tend to think of as being somewhat more intangible. So I think it's important to keep in mind the relative precision of what we're trying to do in the Catholic identity matrix. What we're not trying to do is measure results to 4 or 5 significant figures, as they do in, for example, Olympic swimming. Does anyone recognize this image? Yep. Absolutely. This is from the 2008 Olympics. It's the end of the men's 100-meter butterfly. And that's Michael Phelps in the left-hand lane. And if you watch this on TV, as I did, I swore that the guy in the right-hand lane, Phelps' Serbian rival, actually won that race. It actually looked like he got to the wall first. But in fact, the timing system in the pool indicated that indeed Phelps had touched the wall before he had, that he was the gold medal winner, but Phelps won that race by 1/100th of a second. Okay, let me just be clear here. We're not trying to be that precise in the Catholic identity matrix. Rather, the kind of scoring, the kind of assessment that we're doing is much more akin to what you see in judging Olympic diving. And so that entails observing carefully and then making an informed judgment in light of those observations, in light of the evidence in hand, and also in light of a set of performance criteria. And what the sim does is it provides the assessment teams with a set of systematic structures, a set of scorecards that encapsulate those performance criteria and thus assist with those judgments. Now, the scorecards that are used within the sim are based upon the scorecards that are used within the Baldrige process. The Baldrige scorecards have been around for 25 years, and they've been used fruitfully by organizations for 25 years. So I'm just going to show you what one of the scorecards looks like, and then we'll talk generally about how the assessment teams use them. So this is the scorecard that's used for evaluating responses to questions in the measurement cell for the principle of holistic care. So this scorecard would be used with responses to that first example question that I shared with you. And as you can see, the scorecard identifies 6 distinct performance levels. And the descriptors within each level depict the performance that is characteristic of a particular category. Now, the descriptor for the worst performance level, that 0 to 5% category up at the top, arguably depicts the poorest performance possible. And that's a situation where, on holistic care, the organization has no results. The organization has no data. It has no evidence. It doesn't understand where it is in terms of implementing this principle. So it's sort of like it's out to sea on holistic care, and it doesn't have the benefit of a compass or a sextant. Conversely, the descriptor for the highest performance category, this 90 to 100% category, arguably describes performance excellence. And that's a situation where all trends on metrics of holistic care are positive. Current performance falls within the top decile for comparable, similarly situated organizations. And then current performance also surpasses all comparative external benchmarks. And then between those two extremes, you have 4 intermediary levels that define a kind of graduated scale between them. Now, the assessment teams score their responses by comparing them to the performance descriptions on scales like these. And they start with that lowest performance category, the 0 to 5% category. They compare their answer to the performance descriptor for that category. And if they reach a consensus as a team, they reach unanimity as a team, that their answer depicts performance that's better than that performance descriptor, they go up to the next level. They go up to the 10 to 25% level. And again, they repeat that comparison. They compare their answer to the performance descriptor for the 10 to 25% level. And again, if they reach a consensus, their answer depicts performance better than that level, they go up to the 30 to 45% category. And they continue that process until they can move no further up the scale. That is, until they find the best fit, not a perfect fit, but the best fit for their particular answer. And so in this way, the scorecards enable the assessment teams to make a kind of informed judgment, an informed assessment of their organization's performance within each of the 36 cells within the matrix. So that's how scoring works within the SIM. Let's go back to the implementation process. The combined work of the 6 assessment teams yields a completed matrix. And we're going to take a look at a completed matrix here in a second. And that completed matrix, together with other information, more qualitative information that comes out of the assessment teams, helps the organization to identify relative areas of strength, as well as areas where additional work is needed, where there's an opportunity to better align the organization's operations with those 6 principles for Catholic healthcare. Now, perhaps the most critical step in the entire process is the handoff of those findings to those individuals inside the organization who will be charged with establishing improvement priorities on the basis of the findings, formulating improvement initiatives to address those priorities, and then finally overseeing the implementation of those initiatives. Because that work, that improvement work, is really the culmination of a SIM implementation. It's the end or the goal towards which the entire process leads. So let's take a look at one example of a completed matrix. And this matrix resulted from a SIM assessment that was conducted at a 350-bed hospital in a Midwestern city of about 200,000 people. And this assessment took place during 2011. So it's about 2 years old. Just to orient you to what you're looking at here, darker shades of green indicate relatively higher levels of performance. Lighter shades of green indicate relatively lower levels of performance. And so you can see that the shading helps the organization pretty quickly identify where its strengths lie, where some of the opportunities for improvement lie. And again, this information, this completed matrix is backed up by about 30 or 40 pages worth of qualitative information that gives you more technicolor about what the shades actually mean in terms of where the organization's operations are. Now, one of the strengths that was revealed by this particular assessment was the organization's performance around the principle of solidarity with the poor. And that's a good thing because their local community has been impacted quite negatively. Actually, it's been devastated by the current economic recession. But conversely, several of the improvement opportunities that were highlighted by the assessment concern this principle of acting in communion with the church. And if you look at the colors there, you can just see that you tend to see a little more lighter shades of green on that last principle, on the principle of acting in communion with the church. And after 6 months after this assessment was performed, the hospital launched a couple of efforts designed to enhance its performance around that particular principle. Now, 2 of those initiatives seek to clarify and reinforce responsibility and accountability at senior levels for the hospital's Catholic identity. And I think this makes some sense if you know more about the situation of the hospital. The hospital's current operating team has been in place for many years. They're a very seasoned group. Consequently, they're expecting heavy turnover within those leadership ranks in the immediate future, in the near future, as current incumbents begin to retire. So if you look at the job descriptions for the CEO and the mission vice president of the hospital, they explicitly address the responsibility of those 2 roles for sustaining and cultivating the Catholic identity of the organization. But that responsibility is absent from all of the other leadership roles on the hospital operating team. So right now, the organization is modifying those descriptions and, more importantly, modifying the selection process for those roles to ensure that that responsibility for the organization's Catholic identity is explicitly reflected within the job descriptions and is explicitly considered within the selection process for those other leadership roles. Now, what the hospital discovered as it went through this assessment is it also has an analogous kind of situation with its board of trustees. If you look at the role descriptions for members of the board of trustees, again, their responsibility around the Catholic identity of the organization is not explicitly recognized. So the job descriptions for those roles have also been modified, but more importantly, what the hospital has done is launched a new formation process for its board members to help them understand more deeply what that Catholic identity of their hospital entails, and to help them exercise their responsibility around maintaining that identity, around cultivating that identity more effectively. So those are a couple of improvement initiatives that came out of this particular assessment. One other one I want to mention, because it touches on this principle of acting in communion with the church, but it also touches upon some other principles here, respect for human life certainly, and it also touches upon relationships with critical groups inside the hospital, specifically physician relations. And this third initiative really focuses upon bolstering the role of the hospital's ethics committee in the promotion of the ethical and religious directives through clinical education. More specifically, the hospital's ethics committee has been charged with examining the number and the nature of the cases that they have dealt with over the last several years, to identify recurring issues, to identify issues that have come up again and again and again, and thus issues on which additional education is arguably needed. So the goal here is to use the continuing education process, the CME process, to proactively foster enhanced understanding and also enhanced familiarity with the ethical and religious directives, with an eye towards fostering enhanced physician alignment around those norms and around those standards. So this is an example of one set of results from a SIM assessment, an example of some of the improvement initiatives that we saw come out of this particular hospital. That's not everything that they're trying to do at the moment. And perhaps when we get into the discussion, we can talk about other themes that we've seen come out of the results, and maybe Joan will a little bit about the learnings of her organization from the use of the SIM. Okay. So we're getting to the end here. You've been very patient in listening to me. That concludes the formal introduction to the SIM. I just want to say a few things about the implementation of the SIM within the hospitals here in the Mount Carmel system. And again, discussions around this implementation have just started. Lots of details have yet to be worked out. I do want to share with you a general calendar of milestones, just so you have some sense for the relative timing of some of the key tasks involved in the implementation process, and just once again review those implementation tasks. And this slide identifies those tasks, and it assumes that a hospital would be starting in a July time frame. The implementation begins with two tasks that we mentioned earlier. First of all, the initiation of data collection, and then the selection of the assessment teams. Now, data collection typically is pursued on an ongoing, but on a part-time basis over a period of about 2 to 3 months. And again, it's conducted under the leadership of the organization's mission leader. The selection of the assessment teams usually results from conversations between the organization's mission leader and his or her peers on the organization's leadership team. And there are templates that are provided by the Veritas Institute that suggest the kinds of roles that you would want to see on each one of those teams. And those templates provide a starting place for those conversations. So you're not trying to create this from scratch. The training of the assessment teams takes place in the third month of the implementation, in this case in a September timeframe. The assessment sessions themselves typically follow on the training about 4 weeks later, about 1 month later. We want to capitalize on the training by pretty quickly following up and performing the assessment. And then it typically takes the Veritas Institute to take all the results and analyze those results and put them into a format. It typically takes about 2 months for us to do. So in this case, the hospital would be looking at receiving a formal report from us in December. So soup to nuts, start to finish, activities around the implementation take place typically over about a 6-month time period. The hospital's involvement is heaviest in those first 3 to 4 months. So let me just stop there. And Sister Barbara, I don't know how you were planning on conducting the discussion, but I'll be happy to deal with any questions or address any questions that folks have.